Time now for this week's Health Matters. Paul Critz with you, along with physician assistant Lynn Szabo. How you doing today, Lynn?
I'm doing good.
So we're going to take it on the road this week.
Yeah, this is a scoop, kind of.
A scoop? Okay. All right.
Yeah.
Let's dive in. Mobile medicine.
Medical, yeah.
What's that mean, mobile medicine?
So mobile medicine, we actually have it up here, but the two community clinics, Del Norte Community Health Center and UHS, both getting to the end of having specially constructed clinics that look like think bloodmobile.
Uh-huh.
Okay. And they're talking about getting them staffed with different kinds of healthcare professionals and taking them to the people.
Wow, right on. That's excellent. Now, I knew that Open Door was working towards something. I did not know that UIHS was as well.
I didn't know either. This is something I learned in the last couple of weeks.
Is this the scoop?
Yeah, this is
the scoop. Okay,
you got
cool.
a scoop, Paul.
All right.
So I don't think it's kind of a slow motion scoop because it seems like the process of making a coach for a medical clinic to be taken out in a rural community takes forever. So it's been about 3.5 years.
Conversation I had with somebody from Open Door back when we did the video at the thing up the road here, right? The
homeless
the
one.
clinic, the pop-up clinic. Yeah. And he was talking about how many years it was taking to do theirs. And I guess, these things don't come off the shelf. Each one seems to be custom designed and built for the needs for that particular client. So that's probably what takes up a lot of time.
Yeah. And they have a lot of cool stuff in them. So I thought it would be, I actually think this might be a time where Joe Average Del Norte or Josephine Average Del Norte could throw their 2 cents in on what they'd like to see.
Oh, interesting.
Yeah.
Oh,
so
wow.
That's why it's a little bit early, but it could be timely.
So So what are the choices? What does Joe and Josephine Del Norte have to choose from as far as what's included in this mobile?
Well, let's get to that, but let's define what it is first.
Okay.
So it's a specially designed van or bus, we kind of said that can provide various types of medical or dental or psychological care in a remote or special needs population. So they've had it for a long time in Humboldt County. The Open Door system's been doing it. And so they've been going to homeless camps there mostly. But this would be different. This would be rural communities and probably specific events.
Now you talk about this would be different. You mean the UIHS one would be different?
Both.
Okay,
So,
both of them. Okay, cool.
For example, UIHS, they could take theirs to a fish camp at the mouth of the Klamath. Think about what an acute care provider could do there, like stitches and burn care and fish hooks, all kinds of fun stuff. But they could also take it to Smith River, maybe on a Sunday, and take care of the migrante population with chronic health needs. Or it could be dentistry. The current coach that Del Norte Community Health Center has is all set up for dentistry. Or my hope would be that it could be encasing an opportunity for telehealth by a psychiatrist, maybe out of the area. And it could be something that they take like by the homeless camp.
Wow, interesting.
Or just a counselor. Everybody's got stuff to talk about with a counselor these days. So, maybe opportunity for counseling to come to you would be good,
And so first off, it's important to understand the need here.
Yeah.
And probably in every rural setting in America, but the need for this kind of mobility of medical assistance.
And even within this, let's say a Del Norte County, there's different need depending on, event or timing or time of the year or population that you're working with.
Yeah.
Like, I think it would be super cool to take it to the basketball tournament that they have in March. And if it's outfitted for x-rays with a remote radiology read, then you could, check out all those twisted ankles or, someone fell off the bleachers or somebody got the ball thrown at their face, stuff like that. And, kind of tailor it even to be for people who might be tourists out of the area. And then, of course, you would only do that once a year. So it's got to be flexible enough to be able to take somewhere else, maybe the next week.
Are there any concerns with it being, under the aegis of UIHS, United Indian Health Services, or Open Door, as far as, people, a parent with a kid or somebody falls off a bleacher at the basketball tourney in March, them accessing healthcare through?
I think that would be easier to do through Del Norte Community Health Center because UHS, of course, is for Native people, but they have historically opened up some of their resources for reasons that are important to them. For example, they did community vaccination with their vaccine supplies, and that could be another use of a mobile medical clinic. We did a lot of our vaccinations like in shut down restaurants and random buildings that were primarily designed for their uses, but it would be nice to have something that's more medical. And vaccinations are kind of hard because you have to transport vaccine in a very specific temperature-controlled environment, and there's times and stuff, and it all has to be done very precisely. So it's nice not to try and rely on the refrigerator at the casino kitchen.
I'm thinking more specifically of like insurance concerns and payment concerns. Having been, I'm going to keep bringing this up every healthcare until it changes. Having been a patient in Open Door and then moving on to Obamacare and told that I was no longer a patient at the only place I've ever been a patient here in Del Norte, I'm wondering about if I'm at this basketball tourney, my kid twists an ankle, would I be able to actually get any medical assistance?
Yeah, I think at Open Door you could.
On an emergency basis or something like that? Because
it would be like the acute care clinic on Saturday, which is no barrier.
So it'd be like a walk-in kind of thing, like that sort of. Okay,
I mean, think about it. It's not to their, financial, betterment if they turn 90% of their people away.
Well, it's obviously to somebody's financial betterment that they turn me away. That's why I asked that question.
Oh, you know what? You're starting to wave, man.
Huh?
You're starting to wave. They're thinking about it on the administrative level, and right now the slogan is "Once an Open Door patient, always an Open Door patient."
That's a nice slogan.
Right.
But when will that become policy?
I think soon.
Okay.
I think it's on their front burner.
Well, keep me posted because that would be really, really nice. I'd like that.
Yeah. So,
I'll stop being salty with Open Door. So it's all about, that's great. What if I'm at that thing and they come and they go, oh, I'm sorry, you're not a patient here
anymore.
Well,
if you had a fish hook through your hand and you showed up at walk-in clinic on Saturday, they wouldn't turn you away.
Okay. All right.
And yeah, it has nothing to do with what you know or who you know. Maybe we should say that. So, but anyway, other things they could do is things like preventative health screening. So maybe it's not even staffed by provider per se, but maybe, a registered nurse, and then maybe somebody who can draw blood. Because I know when I work out at the homeless clinic, behind the Superette here every other Sunday, you run into barriers all the time that you want to give somebody a certain medicine, and they have no way to get to the pharmacy.
Right.
And most everybody's lost their ID or lost their Medi-Cal card. And so they don't necessarily have money to pay for this antibiotic versus that antibiotic. And so you either make kind of less accurate or less well thought out medical decisions based on what you have, or you just hope the person can get a ride, and they don't. They can't really. They don't have it that much together. So what I want is to have like everything I could possibly need targeted.
Wow.
For that. So for a chronic medicine clinic, that could be difficult because there's a lot of blood pressure medicines. There's a lot of different blood thinners. There's a lot of, and also kind of with that is somebody has to do the labs.
Right.
Because I can't put somebody on blood thinners if I don't know how thin their blood is at the moment. It's not safe.
Okay, so are you talking? I mean, it sounds like you're talking your way up to kind of a limitation of a situation like this.
I think there's kind of two limiting factors here. One is it has to be flexible to meet the varied needs, and one is it has to be specific enough if you have an oddball need.
Right.
Yeah.
Wow.
So I think it's got to be well thought out. And from what I know so far is that these coaches are being designed not necessarily with provider input. It's not clear to me. It might have been 3 years ago that there was provider, and I just wasn't aware of it. But I think there should be provider input, like even down to, no, I think that the med area should be bigger because I want to have a more variety of stuff if I'm going to be providing these services. But we kind of digress.
Okay. Well, that's what happens.
And you also, but along that line, actually, you have to have providers that are comfortable with a wide variety of skills.
Well, yeah, you have to be like a
you
utility.
have to be kind of a jack of all trades,
Right.
medically speaking, and also support people around you. So I would think there's a place for an RN, and there's definitely a place for a medical assistant. There's super duper a place for behavioral health.
Oh, God, yeah.
And
yeah.
in fact, you could send the whole coach out just for a
as a
day of
behavior-
behavioral health. And then dental, of course. So what if you have a dental coach and, how it's almost have to have two coaches because you're going to have a dental one with specific stuff and medical one, So actually how it gets put together, no wonder it's taking a long time. It's kind of interesting.
There's a lot going into this, right? And a lot of like fortune telling and trying to tell the future and what you'll need, and a lot of research, I would assume, as to historically would have been the needs in a specific location and in a community. But it seems there's a lot that goes into that. Yeah. And it seems like the space it's trying to carve out medically is analogous to how you've described what the role of the emergency room is, which is
right.
But it's also different. It seems like the emergency room exists to keep you alive and to get you to more long-term, in-depth care. It's basically to address the emergency right there, and that would seem to be sort of like part of the purpose of mobile medicine like this. But then you also have to straddle in that. I guess what I'm trying to say is the emergency aspect of it that I'm perceiving is the aspect of like, we don't know what's going to come through the door. So we kind of have to be prepared for a wide spectrum of possibilities.
Right. So mobile medical clinic triages.
Yes.
I think that's what you're trying to say.
Exactly.
And so I, as a provider in like the open door coach behind the superette every other Sunday, if somebody comes in that I think has medical need because I'm worried they're going to die in the parking lot of the superette, then my job is super easy and super difficult. My job is to call the ambulance, and then to coordinate with the ER to make sure that they know they're coming and stuff.
I'm thinking specifically the kinds of things that would show up would be like wound care, things like that.
Wound care. And then, could you plug people into other, like the wound care clinic at Sutter a little bit later on, but do what you can. So that means that you got to have a certain amount of bandages or suture or splints or, like antibiotic ointment and stuff like that. So it all eats up space.
But coupled with that is also it's straddling the space of here's the emergency triage kind of role that we're in. But then we also have to be preventative and have that ability as well. And that takes up space too.
Right. So whoever, the bottom line, I think, is somebody who works in this has to be super flexible.
Right.
And there's going to be more than one provider. So there isn't going to be a mobile medical provider, although they're kind of talking like that's what they want. But really, there's going to be the one that provides psych and the one that provides wound care and the one that provides hypertension and or chronic illness, and then the one that's behavioral health. So, which is psych.
How do you think it should be staffed? Should there be a dedicated person who just knows this van and its or this bus and its capabilities?
No, I think it should be rotating.
Everybody should be a part of it.
Yeah, and I think there should, when you announce that you're going to be in a certain area at a certain time, you can open it to everything because any provider should be able to call 911, right?
Right.
But you might say, look, we're here with an emphasis in, musculoskeletal injuries from the basketball game.
Sure.
We're here.
Some sort of screening. Or
we're just at this middle school at Smith River because we want to do sports physicals for everybody. Bring them down to the school at Smith River, and we'll do like 100 of those.
Wow.
So I think it needs, but I also think that sometimes it's going to be somebody who is a different kind of provider for me. And, maybe there's somebody who's more focused on psych. Or, I could do OB. I do a lot of OB for the homeless behind the superette, which is kind of shocking to me because...
And that's sort of been kind of an ad hoc sort of situation in that you were there and then people know, oh, here's a woman healthcare provider.
Who just happens to have some experience in OB.
Right.
So, and then somebody has to be somebody connected to the community because there's going to be a lot of bridge building.
Yeah.
And then it has to be somebody, I think, who's committed to doing it because I think this is super important in Del Norte. You need people, providers especially, keep showing up.
Right. Right.
Okay, because people here don't talk to random guy they've never seen before. Or,
it's not about the system. It's about the face. It's about the person,
right.
you know. Yeah.
Or if you have a new provider in that hasn't really, had a feel for the community, they don't know that the pharmacy situation on the weekends is pretty dire. And so you've got to be willing to think outside the box to
Right.
solve people's problems.
Yeah. Yeah.
So my hope is to get rid of some of the artificial barriers. Like, you were an open door patient, and
Yes.
then you disappeared for 3 years. And
Yes.
because you were healthy.
I was doing fine.
And the reward for that is we don't know you. Talk
Yeah,
to me.
exactly. You're dead to us, ironically.
I know, and you're breaking their hearts. But, they move at their glacial speed,
Yeah.
but they always, the arc swings toward justice, right?
That's very, very, very hopeful of you.
Yeah, I am hopeful.
You are.
So, but here's a cool thing. They could offer things that I don't know if they do it here, but it's possible. Could they do mammography, like with the right equipment?
Wow.
Could they do glasses with the right equipment? And how would you do that? Would you have like permanent fixed equipment or stuff that you could, leave at the mothership and kind of transfer it out in and out?
I mean, you talk about these capabilities about doing, glasses, doing vision and teeth, and it's not so much the availability of the services I find limiting as it is the ability of my insurance to pay for it all. So it's I don't know how much help that would be. If there was an open door, if the bus pulled in here and saying, "Hey, we're giving because I need this."
Well, that
I need
could be
prescription
UIHS
glasses.
because glasses are a benefit in that population, actually. And they have an optician or optometrist who's great, amazing.
That's great. And if somebody who's enrolled in that, somebody who's a part
for
of
those
that,
people, they have that. They do have
fantastic.
access to that. But
good for
it's
them. I have to go to
hard.
Costco and Humboldt for my health, for my eyes. So that's where I am. I'm kind of
Right.
angry about all this, actually. I'm angry about the hoops. I'm angry about all. And so it seems like, I have questions when you talk about this bus being able to do all these wonderful things. And I'm going, that's great. If it pulled up outside today, how much would I be able to actually physically walk out there and access?
Don't know which bus you're talking about.
I'm talking about the magic bus you're talking about that's going to
there's
do
two
health.
of them. There's one in UIHS and one in Del Norte.
Which one's doing dental and vision and everything?
That's mostly Del Norte, actually.
Mostly Del Norte what?
Del Norte Community Health Center.
Sure. So I'm saying that's great. That's fantastic.
Yeah.
I wouldn't be able to access any of that.
Momentarily. I think there's an answer for that problem. So,
Okay. If it is the person on the phone at Open Door didn't know it. But okay.
well, you gotta, you have friends in high places.
I know, and it shouldn't have to be that way.
I know it shouldn't, but it almost always is.
Yeah.
So,
But
here's the point then. So you bring this point up without being aware of it. What does the community need from a system like this?
Oh, access.
Yeah. So you're saying access. Okay. And then what else? Do they need? Like something on Sunday because that's part of access in Smith River for the migrante population.
Sure, yeah.
Do they need the pharmaceuticals there? Because especially on weekends, we don't have pharmacy access. So, but I don't know. I'm not really a patient here. So
Neither am I.
apparently. Yeah. So, but if somebody's out there and listening to this and is thinking, well, it would really help me, XYZ. So now's your chance. Call up your community clinic system of, that you work within and say, hey, I hear that you're thinking of mobile medical. Could you guys this would be an idea that would really work for me. What do you guys think about it? And because I think right now we're further enough in the process that we have it foundationally set up, but not so far in the process that these little adjustments couldn't be made.
Okay.
So I think this is the spot for, I have a dream that medical care is going to be accessible in this way at this place at this time with, maybe even this type of provider.
And and there's a number of different avenues to address this as well. We're talking about the physical capabilities of this coach, this bus, this
Right.
mobile.
These are
We're also talking about the program that supports it.
So
and
what
the access.
insurances are you going to take, and how would that work for me if I have the Affordable Care Act insurance from the California Exchange? Is it going to cover a mobile medical unit? Or if let's say I have that type of insurance, but I really need to see a psychiatrist, is kind of a merged mobile medical telehealth model going to be accessible to me?
Right. And I think because it's right
I think
now
it's more accessible than ever. But I think Joe Average administrator might not understand the problems. Somebody building a coach might not understand the real need. Stuff like that. So now I think it's time to put your 2 cents in with Del Norte. So
is there a way to do that? I mean, it's one thing to say, hey, just call them up, but you call them up and, which menu button is that? How do you do that? How would you go about, if you weren't involved in all of this, how would you go about getting your views aired and heard with an organization like Open Door?
I would talk to the director of Del Norte Community Health Center right now is Annabelle Dominguez, and she's amazing. And she's the kind of administrator who started as a medical assistant, and she understands the need, and she has been working with them for like 20 years, and she understands their system. And I think she would welcome phone calls from the public for respectful dialogue. Okay. Annabelle Dominguez.
Okay.
She's like the lady in charge, just kind of took the reins over.
Down in Humboldt or here?
Here.
Okay.
She's here. And that's even more important because Humboldt, of course, advocates for Humboldt kind of priorities. And she's born and raised in Smith River, is raising her family here, has worked in the system for a long time. Super friendly, super open to discussion about these kind of things.
Great. That's a good person to talk to.
You can call her at the clinic.
Yeah. What kind of insurance she has?
Clinic insurance, I imagine. But she doesn't always have it. I don't want to speak for her, but I would not be surprised if she's, been on other alternative insurances
Sure.
in her lifetime. She's like one of us, man. Okay?
I don't feel like one of us.
You don't?
No, I don't. I feel like I have made just enough of myself and just enough money to lose access to healthcare in a community like Del Norte. Because now I'm no longer among the ranks of the people who would get, standardized healthcare from a very liberal government in Sacramento. Now I'm among the people who are out here with capitalism.
Yeah.
That sucks.
I hear it. That sucks.
And
I have the same problem.
Angry.
But my solution is that I can curbside people, and I have resources that are like unofficial.
Right.
And I'm a little ashamed to say that, but I don't know what to tell you except it's healthcare right or privilege. We always come back to that.
We do.
Yeah.
We say one thing and it's actually the other thing.
Yeah. So when I was in my kitchen this morning, sitting typing this out, I was kind of dreaming about what could be. And so, with services I think that they should have offered that I don't think they have thought about it was maybe monthly injections for people who are on psych meds. And, who are on medication that maybe if they took oral pills, they wouldn't take it reliably, so they get monthly injections.
Can you give me an example of that? What's that like?
Yeah, that's the thing.
What sorts of things? What sorts of injections?
Antipsychotic medication. Invega comes to mind. Super expensive.
I didn't know that was like a booster, a monthly booster.
Well,
thing.
think about it. It ups compliance, and they actually feel better medicated. And it's not like I just don't feel like taking these pills, today. So, people actually are a lot more functional on it. So you could show up maybe in Smith River and, have an availability to do injectable psych meds for people who have been prescribed that.
It's a dumb question. This thing is going to be digitally capable, right? It's going to be wired up to the internet. Okay, sorry. Because it seems like it would sort of have to be, specifically in that sort of situation.
Right. Connections to social workers like they do at Patient Services in Del Norte Community Health Center, where somebody's able to plug you into different programs. that you might qualify for,
Right.
and that would be helpful because I think people who are super rural also are in food deserts more than likely. Yeah. So, could they help with that? Could they have some food boxes, things like that? Birth control with STD diagnosis and treatment. That's also another type of every 3-month injection is a birth control.
Wow.
Method, but there's other ones too, like Nexplanon's in and out. And again, it depends on the skills of the provider. So we have different providers with a variety of skills. Dental services already on my dream list. Acute care services we talked about focused on the situation, but also chronic health management with Spanish-speaking providers,
Very
if that's
important.
relevant.
Very important.
Or Hmong-speaking providers, if that's relevant. Although,
doesn't seem like that's not I don't know. I don't see a lot of homeless Hmong people.
yeah.
Have you? Do you experience that? I mean, and
Yeah,
I'm
but
not
maybe
saying
they're
that's
not homeless. I mean, maybe they just live rurally.
Oh, true. I was stuck in the see.
Yeah.
Live rurally, or maybe for whatever reason have reticence as far as accessing healthcare through any of the ways that are here. And if it were known, they could go in and speak to somebody. That might be a positive.
Or,
thing.
what happens in Del Norte a lot? One thing I saw when I was at my when I was doing the walk-in clinic for Sutter is people are just driving by on their way to Walmart and the clinic's open. Yeah. I wonder if I can get my inhaler refilled. Is there a lot of people in the parking lot? No, there's not. So, I can go in, just get it done, really. So the spur of the moment stuff like that. Immunizations. This would be super helpful. Now that I do more pediatrics, what I'm finding out is that it's really hard to get an appointment to do a well child check and get the shots and the paperwork that kids need to be in school.
I'll be damned. Wow.
Yeah, super hard. Sports physicals, huge problem. And I hope they start it in the spring because I see this as kind of a seasonal thing. I think it might be hard to get
that would be something that I would say would need to be addressed. This needs to go year round. And
I think year round, but start it in the spring and get the bugs out of it.
Oh, okay. No, you're right. Yeah.
And so that it's like opening a restaurant. There's a certain growth curve in the first couple of weeks.
Don't start Easter weekend.
Yeah. I don't have the review on the first day.
Right.
So, but so that you don't have to solve the problem about how to keep vaccines refrigerated appropriately and how to get around the slide when you're, when it's misbehaving.
Right.
So stuff like that. And then the computer base, I wrote that I hope it wasn't computer based because I know from the homeless clinic on Sundays that it's super hard to get a hotspot that's workable.
Right. That's why I was thinking this vehicle should be its own.
Right. So then I thought, okay, that's not really fair because what if I'm taking care of somebody and he's talking to me about his high blood pressure and he really needs to be on something and he said, well, he had the pink pills until they ran out. And what does that mean?
Right.
So I really need to, have that access to past medical records and stuff. So I think at least for the initial couple of times, they should have an invested IT person who is there. IT guys, what they do is super important for the clinics, but they're not always there when we need them. And so people solving IT problems are like people who just ran down to Radio Shack to try and find some last minute thing.
Right.
And they know maybe a tiny little bit more about it than I do, which is virtually nothing. So, and then I thought, well, why couldn't you have paper charts in there? And then I thought that's crazy because you want to save that space that paper would be taking up for. Besides, you don't know who's going to show up, So, I think an invested IT person to make the computer part of this work super important, especially, and it could be somebody who's on call that you could talk to, but I think it would be better if it was somebody the first couple of times who was actually
just there and could,
there and saw the problem. I can't tell you how many times on holidays with walk-in clinic at Sutter, we would have no computer access because nobody works on Memorial Day, right?
Oh, wow.
But disease doesn't take a day off, and neither do we in this profession. So,
and not having access to that sort of thing can get in the way of decent treatment of something.
Completely. You could make, well, maybe the pink pill was this. Oh, it wasn't.
Right.
And so you really have to have invested IT, at least for a short period of time. It has to be thought of in a logical way. It's not a Radio Shack solution.
Right, yeah.
Okay.
So now, do you know how far along we are in the process of getting these?
I think February.
Wow, excellent.
Both coaches have taken about 3 years to make.
Wow.
And they actually had hired some providers who are no longer available, and just kind of like their time ran out, and
while they were
hired them
waiting
to
for
do this, and it never happened, and so
do you know
moved on.
Are they being built by the same people, or are there?
I would not be surprised.
Yeah, it seems pretty specific.
Yeah, people talk about like some place back in Illinois. It's
okay.
about as specific as you get. You could also ask who's paying for this, because these are super duper expensive.
Yeah.
I think it's a mix of federal and state money. I wouldn't be surprised if it's part of the Affordable Care Act in some way. But I think it's probably super expensive, and these are beautiful coaches.
Right. And
I'd go for less beauty and more 4-wheel drive.
That might be
possible,
right? If you could get up low divide, or get back in the hills there for that. That could be cool.
I think that could be super cool.
All right. Well, that's all the time we have. I look forward to both of these vans showing up, or vans. They're not vans; they're bigger than that.
They're coaches.
Coaches. I look forward
to
to
Bloodmobile.
I think Gray Line.
Yeah.
It's the red line. Yeah. But these coaches showing up in February, and I would like to know a lot more about the, who's building them and the things that go into that as well. So more content ahead, if not with specifically with Health Matters, certainly for Redwood Voice and KFUG, we'll be looking at these vans. I'd like to say, or coaches.
I think they're going to show up about February.
Nice.
Both of them seem to be on the same timetable.
Right on. All right, Lynn. Well, anything else?
No.
Okay. All right. Well, thank you so very much. That does it for this week's Health Matters. And Lynn, we'll talk next week.
All right.